Good morning, Queensland, and good morning to our Facebook Live followers as well. So I can report that we've had 23,630 new cases, and that includes 10,182 positive rapid antigen tests. Tragically, we have to report another 3 deaths from this wave of the pandemic. The Chief Health Officer will give a bit more detail about that. Once again, we extend our sympathies to people who have lost loved ones in their life. Any death is a tragedy, and to experience it during a pandemic is heartbreaking. Can I also report that we've done 43,913 tests in the last 24 hours. Our vaccine coverage is 91.41% at least one dose and 88.35% fully vaccinated. And in good news, 842,869,000 I've got here boosters. That's 52% of the eligible population. The Health Minister will give a few more details about that. And of course, don't forget to our vulnerable seniors out there, if you are at home, the Care Army, and I'll just give that number again, 1800 173 349. I just wanted to update from National Cabinet, just in terms of the Prime Minister announced that list of essential workers. If you recall, we actually announced ours a couple of days beforehand. It essentially mirrors basically the ones that we have generally, with the exception of telecommunications and media and broadcast. So we will be adding that to that list. It's very important that our good friends of the media are able to report during times like this. So we'll be doing that as well. I just want to let everyone know that. Can I just give an update on ex-tropical cyclone Tiffany? So I just wanted to remind people in the Fraser Coast Regional Council, Gympie Local Government Area and North Burnett Regional Council that assistance is available, and South Burnett Local Government areas. And you can call for assistance the Community Recovery Hotline on 1800 173 349. We've already had 639 calls, and as of 2 p.m. yesterday, $80,280 has been paid out to more than 400 people. I've also written to the Prime Minister today seeking Category D assistance. Now, this happens very quickly. There's absolute cooperation when it comes to the federal and state government getting assistance out the door. So this is assistance for primary producers and small business. You may recall I mentioned when I was up there the other day that small businesses were telling me that they needed support pretty quickly. A lot of them had lost stock. So this will go towards helping that replacement of stock as well as their clean-up. So we've written asking for the impacts for the severe impacts for crop and livestock losses. So we're asking for around $26 million in assistance there, so that'll cover livestock loss, crops. This is just the initial assessments as well. We expect there to be more. And in Maryborough, I'm advised that there's 80 homes impacted and 70 small businesses. So we'll be making sure that we get more information out to people. I can also advise that the Deputy Premier and Paul de Jersey will be on the ground on Monday. So they'll be travelling across the region and visiting some of those towns that were isolated as well that I wasn't able to get to when I went to Maryborough. So the community recovery is well underway, and I thank the Reconstruction Authority for going out there and doing those assessments pretty quickly. And like I said to you, as they get to go to more and more people's properties, as the flooding recedes, they'll be able to do more assessments. So just wanted to make sure that everyone in those regions is feeling supported. And if you do need any help, and don't forget too, that lifeline is available as well if anyone's experiencing any ongoing trauma or feeling upset as to what's happened. Please ring those hotlines, and people will be there to assist you. I'll hand over to the Chief Health Officer.
So sadly, we have 3 deaths to report today, 2 people in their 70s and 1 in their 60s. None were vaccinated. Our thoughts are with their families and loved ones today. And out of respect to their families, we will not be giving any further details about these patients. In terms of the hospital situation, we now have a total of 589 people in hospital requiring treatment. That includes 41 patients in hospital in intensive care. And I'll say that again because the way we've been reporting it previously was causing a bit of confusion. So we now have 589 people in hospital in total today. That includes 41 patients in intensive care, and of those 41 patients in intensive care, 15 of them were ventilated. So the 589 figure is up from 586 yesterday, and the figure of 41 in intensive care is up from 26 yesterday. So there's a steady increase in the number of patients in hospitals, not an explosive increase, a steady increase. It's across Queensland. The increases are across Queensland in all regions. Seems to be particular growth in Brisbane south of the river. That's where most of the growth is occurring at the moment, but not explosive growth, but steady growth across the state. Thank you very much. I'll now hand over to the Health Minister.
So I just want to thank all of those people who are registering their positive tests with their rapid antigen. I do want to remind people, I know when you get that first positive result, you might be a bit anxious. You know, there's plenty of information on the website and to follow that advice, to keep track of your symptoms, and of course, you know, just look after your health and those in your family. I do remind people that as other people become positive in the household, which is highly likely to happen, make sure you are also registering their positive tests as well, so we can get an accurate idea of how many cases there are out there, and of course to support you as you go through dealing with COVID. I want to say I think it's great our 5 to 11-year-old vaccination rates. In the first 3 days, we have had 5.96% of all 5 to 11-year-olds in Queensland vaccinated, so almost 6% in just 3 days. And we know that number's going to grow as our pharmacies and GPs are able to come online as they get the vaccine supply delivered to them. And we've got 45,267 young people 5 to 11 booked in for appointments from today forward at our state clinics. So that is great. Keep coming forward. I do want to say that our 12 to 15-year-olds are not at the same high rate as our adult population of 16 plus. So if you haven't got your teenager vaccinated, or they are eligible for their second boost, and it might have been you delayed it because of the Christmas break, please come and get that vaccination as soon as they're eligible. And if you haven't got vaccinated yet, please do. Of course, bring the whole family. You know, all of the children can come in and get vaccinated, and the parents can get their booster at the same time if they're all eligible. We have secured now 637 private beds already, and we are already moving some of our public patients into the private system, and I know that's creating capacity in our public hospitals, which they're very grateful for as we move towards a greater surge. For those who do have symptoms, who are unsure whether they have COVID, they're not able to get a rapid antigen test, of course they still can come forward and line up and get a PCR test. Again, please just be respectful to all of our health workers, particularly those working in ICU and COVID wards at the moment. Thank you for the tremendous work you're doing, but we also know any person who walks into a hospital could be positive or become positive while they are there, and I just want to thank all of our amazing health workers and frontline workers who are doing such a great job.
Thank you, Premier. As the state's vaccine operations coordinator, I just want to give a little bit of an update this morning on our vaccine program. So as the Premier indicated, we're at 52% of eligible people who have had their booster. But what that also means, there's 48% of people out there who are eligible now to come in and get their booster. We are seeing really good numbers of people getting vaccinated right across the system, and in fact the system of both primary care and Queensland Health did over 372,000 vaccinations in the last 7 days, which is terrific to see. But my message is really clear. We do have capacity for those people who are eligible for their booster now to be able to walk into our Queensland Health sites and to be able to get boosted. We also have capacity for those people who are still waiting to get their first dose and will still do your second dose in our system. We have that capacity, and of course you also have the option of booking in with your community pharmacy or your GP. On our 5 to 11-year-old vaccinations, we are progressing really well, but what I will say is I'm hearing community advice that people have now got their children booked in 4 and 5 weeks ahead. Could I just put a message out? Every day additional vaccine appointments are being released, whether or not they're in our state clinics or as more pharmacies and as more doctors come online delivering the vaccine, they're releasing new appointments from their clinics. Can I ask people who have got their children booked in 4, 5, 6 weeks ahead to please, every day if you can, go online and see if you can bring those children in earlier so that we can get as many of the 5 to 11-year-old cohort vaccinated before we go back to school. On the 5 to 11 cohort, at our state hubs, if you go onto our Queensland Health website, you will see our hubs that are delivering 5 to 11 vaccines, and a large number of those hubs you're able to walk in with your 5 to 11-year-old and get vaccinated. So please go onto our website and have a look, and you'll see where you can walk in. Can I ask, if you are walking into one of our sites, now we have had delays of up to an hour at our sites, so please bring some food and water and something for your children to do while they're there, and we've got resources also to help out. But we're really keen to lift those vaccination rates with our 5 to 11-year-olds. Thank you.
Premier, I know we touched on it just a little bit yesterday, but just moving forward now, we're still anticipating around the 22nd of January for that 90%. What will happen now with Wellcamp? I know that you said that you would update us as it went. You'll probably still use it in the next week or so, if it's ready?
Look, the Deputy Premier will update everyone on that next week, but don't forget we still have people who fly in who are unvaccinated. Don't forget too that we don't know what variant is around the corner, so we are prepared. We have a quarantine facility that is absolutely going to be prepared for Queensland if we need it and when we need it into the future.
Are you expecting many people, unvaccinated people, to be using it? Like, do you have numbers over the next?
I don't have those numbers.
Does anyone in government have those numbers?
Well, not at the moment. It depends. Like the airlines, they have those. Yeah.
And Premier, just on the airlines, again, you sort of touched on it yesterday.
Yeah.
With those overseas flight crews, the 14 days, will they just now come into the 7-day period that Queensland is?
I might get the Chief Health Officer to comment on that particular question. Any other questions for me at all?
Premier, we've seen an explosion of cases amongst First Nations people is now up to more than 3,600. How concerned are you? And doctors in Yarra say there are now 75 cases there. They're worried about food security. What is the government doing with this?
Yeah, that's a really good question, and we have been out and about into all of those communities urging people to get vaccinated. As you've heard from the Chief Health Officer, tragically, 3 people who lost their lives today, there are no reports of vaccination. So every Queenslander, let me say this very clearly, every Queenslander has had the opportunity to get a vaccine. There has been misinformation that has been circulating on social media, and let me make it very clear. The vaccination will help prevent serious disease, and the booster is an added layer. So it is not too late if you are out there and you are unvaccinated to go and get the vaccine. Please go and talk to a trusted health professional if you have any concerns whatsoever. I'm hearing reports that some people are unvaccinated and doing a rat test every day. Now, that's not going to stop you from getting COVID. So please go and speak to a health professional, go and get that direct advice and get vaccinated. And it's great to see that the vaccination rates are really climbing up across the state, but especially in our Indigenous communities, there has been a big drive to get people vaccinated, and we've had the likes of Jonathan Thurston, Steve Renouf, everyone out there encouraging people to get vaccinated. If you have not had that vaccine and people have gone door to door, I mean, I don't know what else we can do.
Are you aware of the food security concerns?
Sorry?
Are you aware of the food
Look, I'll follow that up, but we have had, discussions at National Cabinet about making sure that supplies can get through, and that's why we've made some of those changes to that essential workforce. But if there are any particular concerns, we will deal with those issues of those particular communities.
With close contact issues amongst hospitality workers, and also are you encouraging vulnerable communities to perhaps restrict their movements at the moment? We're hearing a lot of small businesses say the trade for them is like it was back in lockdown. Has there been any thought given to a support package for small, medium business during this time, in which it is just a need that you're saying, you want people...
No, what we've said very clearly is that we are concerned about the vulnerable people at the moment, because that's the impact that this wave will have. So if people are vaccinated, they're wearing their mask, and especially those who are boosted, they should be going out and living their lives and supporting local businesses. That's my message. So it's really interesting. In some pockets of Brisbane, I was driving last night, in some pockets of Brisbane, there's a lot of cafes open. In some parts, they're closed. These are individual decisions that business people will make, dependent on staff availability.
So
No, there is no, because that was taken away at National Cabinet in terms of once we reached that 80%. Yeah.
Premier, did we get to the bottom of the missing rapid antigen test? Minister Bailey took to Twitter again last night, still accusing the federal government of taking some 22,000 tests.
I might get the health minister. I haven't.
I know the health minister didn't know much about it yesterday.
No, I haven't been advised of that.
Just on that, we've been told that the feds have potentially seized orders for rat tests from Queensland around QPS. Are you aware of that?
No, I'll follow that up, but that's a concern if that's happening. Yeah. Okay?
Dr. Gerard.
Thanks.
For the deaths that are being recorded in Queensland, are the majority of them happening at home or in hospitals or aged care?
It's a mixture of all of the above.
Okay.
So it's a mixture of all of the above. That's what I can say. We've had a handful in aged care. We've had some in hospital and a few at home as well. So no, it's a mixture.
Are you concerned that there are deaths happening at home, and is that a constraint on the health system?
Yes, it does concern us when there are deaths at home. From the few reports that I've been seeing, we're seeing reports of people having an illness for a short period and then sudden deaths, and we've reported about those earlier on. That's been reported elsewhere in Australia, around the world, where it's myocarditis, which I think I've referred to on a previous occasion. But we are certainly keeping a close eye on those, particularly when there are deaths. We investigate those particularly if there's anyone who's died at home. Yep.
Dr. Gerard, just on the question that was put to the Premier about the overseas posties, are they going to be...
So we're talking about, so just to clarify, we're talking about the quarantine periods for flight crews and for the next week until such time as we reach the 90% target. I assume that's what your question is about.
That'll just...
Okay, so we're actually actively looking at that at the moment. That's all I'd say. So, okay, we're having a look at it at the moment.
Once we hit that 90%, do they become like every other member of the public and free to become...
That's what we follow the roadmap, which at 90%, if you're vaccinated and from overseas, you will not quarantine.
So the hospitalisation, 589 new ones.
Yes.
You said it was a mild...
589 from previously, it was 556.
Is that quite a small increase then, without playing it down?
It's a steady increase. That's a steady increase. I mean, that's a steady increase, but it's not a huge increase in a 24-hour period. No.
So at what point do you start to make a call on whether we are reaching the peak?
That's the question on all of our lips at the moment. You would have seen in the media this morning that New South Wales believes that they are at their peak. Our modelling has suggested that Queensland in general is about 2 weeks behind New South Wales, but different areas will reach their peak at different times in Queensland because we're a more decentralised state. So presumably, and this is a bit speculative, Gold Coast, which was the first region to seem to get its growth, presumably will reach its peak earlier than other parts of Queensland. That's what one would expect.
Did you find it strange, Doc, that yesterday yesterday we were only, I think it's 14,500 cases, now we're back up to 23. It went sort of...
Well, it's interesting that a lot of those were the self-reported rat tests. So people are clearly getting rat tests from somewhere. So we had 10,182 positive self-reported rat tests yesterday. So there clearly is increased supply, presumably both from Queensland health sources and I assume from retail sources as well.
And would you suggest in the modelling that we're looking at moving into this peak?
Yep.
A lot of people would have been in Queensland for the holidays, we would have seen those high numbers, but a lot of people now have probably gone back to Victoria, New South Wales, and that. Do you think that might help steady our Omicron wave?
No, I think we'll still see exactly the same because it's now in the general Queensland community, and we're going to see steady growth until we reach a peak sometime in the next 2 weeks. But as I said, it's because it's a decentralised state. I think we're going to get peaks at different times in different regions.
What's the marker to reach the peak? You need to peak worth of,
Yeah, that's something of that order. Where we're looking. The most useful things to look at will be hospitalisation rates rather than the numbers of cases, and we're looking at those closely every day. And it's when the hospitalisation rates start to steady, and Gold Coast has been relatively steady for a day or two, but you can't read too much into a day or two's worth of data, so I don't want to overstate that. But I think the Gold Coast will be the first to peak, and then others will follow. But I really must emphasise, it's too early to try and speculate from the data that we have.
This is long-term stuff, but do you foresee a time where COVID is no longer a notifiable disease when we become endemic, or do you think we'll still registering every case?
Years down the track, it will no longer be a notifiable disease, but it'll be notifiable for some time to come, I think.
Does council have enough ambulances? There have been reports from the opposition. They're talking about 2 deaths of patients with ambulance.
Look, I'm aware of those deaths. They're under investigation at the moment. I think it is certainly too early and, again, completely inappropriate for the opposition to draw links to any availability of ambulances to deaths when they are under investigation, internal investigation, QPS and coroners. So, let's leave it to the experts to determine whether there was any contributing factors, but it is irresponsible of the opposition to be trying to make clinical decisions on and findings without those experts still completing their investigations. Look, I went and visited QAS yesterday over at Kedron to see how they were going. I mean, they've certainly seen an increase since the surge, the wave started to happen. Surprisingly, yesterday was a little bit quieter for them. I would say quiet, but they saw a little bit of an easing off. But, I'm sure that's going to pick back up again. They've put in place a whole lot of new measures, including clinicians who man COVID lines, dedicated COVID lines, to talk to people and triage whether they actually need an ambulance to come out to them or not. I'm hearing that that's probably, for every one clinician sitting in that team, they're probably saving 8 paramedics on the road from having to go to deal with those patients. So it's really seeing improvements and streamlining the process and making sure that we are getting the best care where that care is needed and not necessarily sending an ambulance to everyone who calls up saying they think they've got COVID or they've tested positive for COVID. So we'll work with all of the states, a lot of mental health support going on as well, and we've seen a lot of diversion away from EDs because of that. So all of those initiatives are making a difference.
How are we going with the rats? And sorry to ask this question again, just that Minister Bailey took it.
Yeah, and
if that's what's happening.
Yeah, I did talk to Minister Bailey yesterday afternoon about that, and he said they've had confirmed that they've been given reason by the supplier that the stock was taken by the Commonwealth instead. That is disappointing.
Greenham denies it.
Well, Minister Bailey says he's got proof of that, so I'll leave it to Minister Bailey to provide that information. But look, we know there's a shortage across the board. But I would hope that the Commonwealth's working with industries, that if there is a time where government agencies have to turn to suppliers and say, we need, for emergency reasons, to to acquire your stock, that they're looking at where that stock's going. Because imagine if we're pulling back stock only to find that we're doing so to give it to the same people that we took it off in the first place. So, you know, it's...
You're disappointed to hear that it's so strange that the federal government's allocating so many to all around the place. We hear that the Australian Open, they're going to be testing people that come there every day. Imagine how many rats are going there, and we hear that Ipswich Hospital's looking for them. It is disappointing, though, surely.
Oh, look, we've got stock going out to HHSs regularly. We've received around 409,000. We've distributed out to HHSs for public testing clinics. I believe we're expecting today the 1 million from the Commonwealth. Again, half of those are point of care tests, so we won't be using them at public sites. My call for the Commonwealth, and I raised this at the Health Ministers' meeting, again, my Health Department has raised with me this morning that GPs and the primary health networks and aged care are coming to us for PPE and rapid antigen tests. Now, it's the Commonwealth who are supposed to be supporting that and providing that stock, and they told me this week they were. So they need to get that stock to GPs because we can't divert. We will help where we can, we always have, but we just can't be diverting our supplies to primary care when the Commonwealth says they've got a stockpile for that very reason.
Minister, just on the
Last question.
the flight crews you mentioned yesterday and maritime workers, you said he needed a few more days to work out.
Yeah, and I might just clarify what the Chief Health Officer said. Yeah, we actually, can I be clear, when we hit the 90%, that's for the general international arrivals. The air crew and the maritime have a different health directive, and we're just working through that. I'm looking at all of the jurisdictional comparisons and getting advice of the Chief Health Officer what we think we should do for airline crews and maritime arrivals, particularly.
Just one last quick through a quick one.
No, you had the last one.
When we hit the 90% mark, can unvaccinated people come in from internationally and arrive?
Yep.
Unvaccinated.
Unvaccinated.
No, they'll be quarantined.
Quarantine.
Cool.
Yeah.
Thank you.
Okay,
Yeah.
thanks.
Thank you.